Hi, my name's Livia Hampson and this is assignment 3 for evidence-based practice. In this presentation, I'm going to be discussing some of the benefits and the barriers to implementing evidence-based practice. I'm also going to reflect on conflict resolution in the clinical setting, including some of my strengths and some of the areas that I could improve. Evidence-based practice is the conscious and deliberate action of searching for and using the current best evidence in combination with clinical expertise and the values and preferences of the patient to guide healthcare decisions. It is a core function of a registered nurse to access and utilise the best available evidence for safe quality practice as set out in Standard 1.1 of the Nursing and Midwifery Board Standards. Now I'm going to be talking about the benefits of implementing evidence-based practice. Providing a higher quality of care to patients. Evidence-based practice includes providing person-centered care. In doing this, the nurse acknowledges the patient's experience of their illness and how they would like to be treated. Making the patient or service user heard improves the quality of care experienced by the patient. Improving productivity and reducing healthcare costs. Using the most recent research evidence, like clinical guidelines, to inform practice provides appropriate care to specific situations and creates efficiency and saves money so that the healthcare resources can be maximised. Safer and informed decision making. Nurses who use evidence-based practice are able to deliver a higher quality of care by making evidence-driven decisions that incorporate expertise and research. Relying on evidence-based practice allows the nurse to ensure effective and safe decisions have been made. Now I'm going to be discussing some of the barriers to implementing evidence-based practice. Poor leadership. Leadership is crucial to the delivery of high-quality patient care. If the leader of the clinical care setting is not supportive of staff, it hinders the ability of staff to create change and implement new evidence. Good leadership creates an environment that drives change. Time restrictions and inadequate staffing are commonplace in the clinical practice. Nurses are often trying to survive each shift and care for their patients, which limits their ability to spend time implementing change or collaborating with other professionals to increase interprofessional knowledge. Limited resources and education. Staff may not have the skills and education that supports the ability to find and evaluate current best evidence to inform their practice, or they may have limited resources such as limited access to the internet and computers to guide their decision making. Now I'm going to reflect on conflict styles in the clinical setting. Flexibility and maturity. My flexibility and mature age give me the advantage of knowing that I need to act differently in different circumstances and being able to do this. If I'm new in a workplace, I'm usually accommodating to the more experienced staff, as I believe this is out of respect for their experience and also to create an environment of trust and ongoing respect. In the Yoder-Wise conflict self-assessment, I scored evenly across compromising, accommodating and avoiding. Once I've established myself in a workplace and I know the staff and how they work together, I will feel more confident to engage in conversations on areas or practices that I think will improve on the quality of care. I pride myself on being very aware of other people's views and finding a way to collaborate with people and build long-lasting relationships. Some of the areas that I could improve is communicating and collaboration. I think that I need to work on being assertive in my communication because I sometimes worry about upsetting people that I work with, even when I feel that I have more knowledge. Assertiveness. I need to work on being assertive without being aggressive because advocating for patient care while collaborating with other staff is essential to implementing evidence-based practice. In conclusion, evidence-based practice provides many benefits to the healthcare system, patients and staff. Building collaborative relationships and reflecting on practice helps to provide the best possible care and creates an environment that drives change.
Created using Powtoon.